chronic renal failure on Tuesday, last time I saw you? Or was that Thursday? Today's Thursday. Okay. So on Tuesday, last time I saw you, we covered acute and chronic renal failure. And this slide on here is just showing you some oral ulceration, in this case ulceration on the tongue. And remember we spoke about oral ulcers, oral ulcerations, erosions, and dental tartar and calculi as being part of the hallmarks of chronic renal failure. So that slide just shows you an example of what those ulcers look like. All right, so under the developmental category of non-infectious urinary system diseases, I'm not going to spend too much time on these just because they are pretty rare, just because they would require a lot of memorization, which I don't like. As far as urethral defects, we mentioned earlier in the series of lectures about ectopic ureters. So that's probably the most common urethral defect that you'll see, that you'll find in large animals would be ectopic ureters. All right. So, so you're always asked questions about most common, and most common urethral defect in large animals is going to be ectopic ureters. And pretty much the rest of that is covered in your notes. As far as what we do when we have ectopic ureters, most practically we just do an nephrectomy of the affected kidney. It is actually pretty difficult to attach an ectopic ureter to the bladder, and a lot of times it's too short to attach to the bladder. So practically speaking, you're basically looking at nephrectomy, basically removing the kidney that has that urethral defect. Just remove that kidney. Remember we said earlier in our notes that you just need one good kidney in order to live. So most of the times the most practical treatment. Yes.
You said it's the most common urethral defect, the ectopic ureters. Earlier you put that it's rare in ectopic ureters. So they're rare, but
they're rare, but they're the most common. If you find one, if you find a urethral defect, it's going to be an ectopic ureter. Okay. They are rare overall. Yeah, most common doesn't mean it's not rare, or vice versa. Rare doesn't mean.
okay.
All right. It's too early in the morning. Yeah. So the take-home point is that urethral defects are rare. If you do encounter a urethral defect, it's likely going to be an ectopic ureter. And the clinical signs are explained there in the notes, as you'd expect if you had an ectopic ureter. If you had a ureter that was not going from the kidney to the bladder, you'd imagine that the animal would have some metabolic disturbances. So it's going to present as being depressed, and it's going to have difficulty urinating. It's just producing urine from one kidney. The urine from the other kidney is not going to the bladder, so you're getting abdominal distension. Urine is accumulating in the bladder, in the abdomen. And remember, we're talking about developmental defects, so this is a neonatal animal that's just a few days old and is presenting with these signs. All right. And as far as your diagnosis, basically you want to know what's causing the abdominal distension. So more than likely you do radiographs, ultrasound, you do an abdominal centesis, and you determine that there's urine accumulating in the bladder. Because of the fact that it's a neonate, you might suspect that it has an ectopic ureter. You could confirm that by doing a contrast study. And remember, we had said earlier in our lectures that you don't commonly do contrast studies, except in this case. This would be one case where you want to confirm that you have a urethral defect by doing a contrast study, and then you'd be able to visualize the ectopic ureter. And then the treatment, as I said, involves, most commonly just involves nephrectomy. Yeah, I'm spending time on that because I already wrote the question, so hopefully everybody gets it. Renal glomerular hypoplasia, don't see that very often at all. Congenital defects of the urinary system, it's just basically memorization. Bovine, sheep, and goats, we have a number of conditions listed there. But I don't want you to memorize that for an exam, for this exam, but maybe for NAVLE, you might want to look at some of the conditions that occur, congenital defects that occur in bovine, in sheep, and in goats. Don't like to memorize. All right, so metabolic conditions of the urinary system. There are a number of conditions that basically cause obstruction of the urinary tract. Ulcerative prostatitis and urolithiasis certainly cause obstruction. So under the general heading of obstruction of the urinary tract, if you look in your notes, you see a few different things discussed in general. And what I tried to do in the notes was to break them down into what anatomical regions of the urinary tract you find the obstruction. So I broke it down into urethra, ureters and kidneys, and bladder. And as far as what you should pay attention to, we'll discuss it in more detail when we talk about ulcerative prostatitis and urolithiasis. And we'll repeat some of the points that you'll read in that section on obstruction of the urinary tract. So, let's see. All right. So one of the things, well, let me present this case to you. Rather than reading back the notes to you, I'm just going to present one of these papers to you that will bring out some of these same points. So some of you are in large animal rotation. So unfortunately today we're going to end up euthanizing that cow with the lung abscess. For the rest of you, this is a cow that presented with chronic weight loss, and on physical examination, you notice that it was having some difficulty breathing, showing signs of dyspnea. It was tachycardia, and it had an abdominal component to the breathing. And we did radiographs of the thoracic cavity. It was small enough to where we could see the lungs on radiographs, and we saw a mass, which we are suspecting is a abscess, lung abscess. We also submitted some blood work, CBC plus fibrinogen, and the fibrinogen was elevated. The CBC, the white blood cell count, was not elevated. But as I tell my students, especially in large animals, the fibrinogen is often elevated before you get elevation in the white blood cell count. So the elevated fibrinogen plus the finding of that mass in the lungs supports the probable diagnosis of a lung abscess. Could be a lymphosarcoma. Usually the lymphosarcoma you wouldn't expect to find the elevation in fibrinogen. Bottom line, the pathology people have the last word. They'll actually open it up and tell you, oh, of course it's a lung abscess, or of course it's a lymphosarcoma. But unfortunately, we'll determine that on necropsy. It's also surprising how emotionally attached a lot of these owners can get to their cows. So it was pretty sad. He has 50 cows, but this cow had been with him for a while, so he was pretty sad to lose it. Took his picture with it and all that kind of thing. So, it's just one of the unfortunate realities that you deal with in veterinary medicine. So we'll do that this afternoon. All right, so back to the urinary system. So this was a case of urethrodithiasis and nephrolithiasis in a horse. And just to highlight a few things in this particular case. So the presentation, depression and dysuria, so difficulty urinating, Horse had a reluctant stiff gait, made frequent but unsuccessful attempts to urinate. So, so by definition, that's something they call pollakiuria. You know, it's basically just trying to squeeze out urine and being unsuccessful in doing that, and it keeps trying to squeeze out the urine. On rectal palpation, so transrectal examination, revealed a large turgid bladder. Turgid just means it's distended. And sometimes when you're, so in evaluating the urinary tract, you also try to palpate along the urethra, and in this case they were able to palpate a calculus within the penile urethra. And so they diagnosed obstructive urethral epiphysis. And then they're talking about the sedation. So remember we spoke about sedation with acetylcholine. As long as you stick to the accepted dosage, you should not get into any difficulty. So they use acetylcholine and xylazine, and they did urethrostomy, and they visualized the calculus. And to remove the stone, they did a perineal urethrostomy, which you guys might be familiar with in small animals like cats, for example, that are blocked. They'll do PUs, perineal urethrostomies. And unfortunately, you start getting some complications. Fluid therapy continued post-operatively because the horse remained azotemic. Remember, we spoke about azotemia earlier in the course of our lectures. And horse monitored for urination, etc., etc. It still has this massively distended urinary bladder. Tentative diagnosis of detrusor atony was reached. So would that be upper motor neuron or lower motor neuron? Yeah, upper detrusor. So upper motor neuron bladder disease. Horse continues to decline over the next 36 hours. I guess you guys can figure out what's going to happen eventually. But transrectal examination, thickened bladder, urine sample collected, abdominal centesis, uroabdomen was confirmed. So now it looks like the abdomen has ruptured. And the horse develops a septic peritonitis, which is usually bad news, especially in horses. They're not able to wall off these infections as efficiently as a ruminant would do, for example. So they eventually euthanize the horse. So on necropsy, they found a tear in the bladder. Left kidney was hydronephrotic and contained